Snoring is a very common problem. It doesn't become a medical problem till it becomes till it's an issue. Snoring is a sign of obstruction to airflow through the nose and the throat, and it happens as we all age, and we are all aging. So it's a common issue. Of course, if we are overweight, the snoring happens earlier, or it's worse. So it's an issue of obstruction to airflow. The obstruction can be in the nose, and if it is in the nose, then the question is it because of congestion, inflammation, infection, or is it a structural problem? If it is in the throat, is it because of anatomical structures like big tonsils or a very long uvula? The uvula is this thing that hangs behind our throat. Sometimes that can flop backwards and cause someone to snore badly. Quite often, most of the time, snoring is because of a weight issue. Okay, most of the people are it's a weight issue. And of course, if you drink alcohol, and you tend to snore more, because alcohol is a muscle relaxant. And so when you tend to sleep at night after a good dose of alcohol, the muscles are all relaxed, everything tends to collapse more, and then you tend to snore more. When you're tired, you're more relaxed, and you tend to snore more also. So if you look at it, it's age. Age is one thing that causes you to snore. 2, weight. 3, food, and like alcohol, drinks and all that, and physical activities. Yes, of course. Position is also very important. Not very important, but it is. If you tend to lie on your back, you will snore more. If then you tend to lie on your side, or you tend to lie forward, you'll snore a lot less. Which is why you hardly see animals snoring, because they all tend to lie forward unless they're lying at the side. If you try and lie on your stomach with your head down and you try and snore, you can't do it. It's not easy. But when you lie down and do, it's easy. So when someone comes to us for snoring, we have to ascertain whether the person has a snoring issue, or is it a deeper issue that goes beyond snoring, and that is what we call obstructive sleep apnea. Obstructive sleep apnea is a condition where the snoring is bad enough that is causing obstruction to the airflow, that the person doesn't get enough oxygen going to the brain at more than a certain period of time. And that can be ascertained with the sleep study, where during the person's sleep, we put some monitors on him or her, and we can ascertain from overnight sleep in the person's house whether or not the person has sleep apnea. Once we have ascertained whether it's just snoring or the patient has sleep apnea, then we can decide on what to do for the patient. If it is due to weight, of course, then the patient has to lose weight. But if the sleep apnea is bad enough, losing weight may not just be good enough. He may have to use a machine called a CPAP machine, which is continuous positive airway pressure, and just you wear the mask and the machine, and it just pumps air through the nose and through the obstruction and allows you to sleep better. Yeah. Of course, if the person has got a congested nose and an infection in the sinuses, then that's causing the obstruction, then we just treat that. And then if it gets better and the snoring goes away, it's good. So snoring is multifactorial. The causes for snoring, of course, age, weight, and structural abnormalities. So we look into everything, and then we have to do some investigations, especially the sleep study, see where the problem is, and we treat accordingly.